Good afternoon, friends. I'm Dr. Shyam. I'm a heart surgeon. I was a professor and the head of the Department of Cardiothoracic Surgery. Last week, I operated on 3 young people. One is 30 years old, another is 35 years old, and another one is just 42 years old. This is alarming. Friends, a 35-year-old young and fit, dynamic guy, full of ambitions and dreams, goes for his morning walk and he collapses. There is no pain more heartbreaking than to see a young life full of dreams and ambitions suddenly stopped. So what's happening to our youngsters in this country today? There was a time when heart disease was associated with the elderly. But nowadays, young men in their 30s and the 40s are falling prey to this deadly disease, which was once considered as a curse of the elderly. The face of heart disease is changing day by day. It's no more the disease of the elderly. Another 35-year-old young man, a marketing executive, always on the go, who thrived on deadlines, coffee, and late nights, used to complain to his wife that I have chest pain. When she asked him to see a doctor, he brushed it away and said, no, it is just acidity. He had his heart rate racing. He blamed it on too much of coffee. He used to wake up in the middle of the night, tired, anxious, and drenched in sweat. He blamed it on too much of overwork. Burnout isn't a sign of overwork. Burnout can be a sign of a failing heart. The body tells us and it gives us signals to watch out for our health, what we call is the whispers of the heart. The whispers are the call for help. The whispers are the sign to tell us, look, go and get yourself checked before it's too late. We, as humans, we have the tendency to push things away. Okay, I will do it on another day. And this another day never came. So this young executive was working on his laptop all night. He had a sudden crushing pain in the center of his chest. He clenched his hand. His eyes were blurry. He felt dizzy. He collapsed. The ambulance rushed him to the hospital, but it was too late. He could not be revived. If you look back, he had the symptoms for months together, but he's been sitting on it and ignoring it. If he would have responded, recognized and acted on the symptoms he had, that is extreme fatigue, acidity, lack of sleep, heartburn, all these things, and gone to a doctor and get himself checked, his life could have been saved. So, how can we listen to our whispers? One, it is important for us to pause and reflect on what's happening. We need to practice mindfulness and meditation. It's important to seek professional help. Now, what are the risk factors for this heart disease? You all know smoking, alcohol, diabetes, high blood pressure, obesity, high cholesterol, family history, high lipoprotein A, and there are many more which are the risk factors for heart disease. It is important for us to get ourselves checked, control our BP, control our blood pressure, control our high cholesterol. If you do not do this, what happens is fats deposit in the inside of the blood vessels of a heart. Once the fat deposit inside the blood vessels of the heart, they get blocked. This will lead to heart attack, and this will lead to heart failure. The other thing I want to mention is about the importance of gratitude in life. Gratefulness is the best healer of the heart. Being grateful for what you have, being kind to others, giving, sharing, and caring for others improves your heart health. When you give, your stress level comes down, your cortisol level comes down, your happy hormones, that is the serotonin and the dopamine level, increases. When the level of your happy hormones increases, your heart tends to relax and your heart is happy and healthy. One of the silent crises we face in our country, or the crisis all over the world, is loneliness. You have elderly grandparents at home. Have you noticed them? Have you noticed that they'll be shunned to one corner? They are hidden behind closed doors. They are locked up in some nursing homes. There's nobody to talk to. Loneliness kills the heart. Loneliness increases the stress level, increases the level of the cortisol. So it is important. So what happens is when the level of the cortisol increases, it affects the function of the heart. The function of the heart is not only just pumping blood to sustain life. It's a silent witness to unseen miseries of the elderly people. You know, it's a silent witness for the emotions, fears, and longingness of the elderly. The heart can absorb the weight of these unspoken sorrows and silent heartbreaks of these elderly. So please, spend some time and give some time to your elderly at home or wherever they are. If you spend a minute of your time of the day with an elderly, it will brighten up their week. Another silent crisis that is happening, is going on in this world, is non-adherence to treatment plans. Doctors prescribe medications. Doctors suggest healthy lifestyles like what to eat, what not to eat, what exercise to be done, how long it has to be done, and the importance of taking medications. Non-adherence to medications leads to disaster. And if you ignore this, you can get a heart attack or a stroke or lethal blood clots. Patients tend to miss their medications. One of the most common reasons as to why they miss their medications is simply they cannot afford it. Financial constraints. They are ashamed to ask their son or the daughter, look, I do not have the medicines to buy my heart medication. So they just simply miss it. The government of India is doing a lot of work. It has subsidized the medications. There are generic alternatives and so on to help them. The other non-adherence is people do not follow heart-healthy lifestyle. We are always on the go, eating all kinds of junk foods. We are not going for a regular health checkup. Sedentary lifestyle, not going for a walk, and no one is listening to what the doctors say, and most importantly, they do not have the time to go and listen to our doctors. Now, this is killing the young generation of this country. Now, what can be done? Why do people do not follow the doctor's treatment? One, it could be because they do not understand what the doctor has told them. They have a fear of the side effects of the medications. They have a fear that they have a fear of the side effects of the medications. They have a fear that they become dependent on the medications. And most importantly, there's a lack of communication between doctors and the patients, lack of communication between the doctors, the patients, and the pharmacists, particularly the elderly people. When you write a prescription to the elderly, they do not understand what's been written. They do not follow what's been suggested by the doctors. They get confused very easily, particularly when you give them multiple medications, they get confused. Most importantly, elderly people are forgetful. They miss their heart medications. This affects the function of the heart. So how can we correct this? Proper education of the patient is important. Better communication between doctors and the patients, better communication with the patients and the pharmacists is important. Friends, heart disease in the young is increasing. The body gives you the signals, that's the whispers, which tell you, look, I'm not well, please seek some help. If you ignore this distress of your hearts, you land up with a disaster. Please go and get yourself checked. Follow your doctor's advice. Please remember, healing the heart is not just the doctor's job. It's your commitment too. May your heart be happy and healthy and with lots of vitality and joy for years to come. Thank you.